Hi everyone, and welcome to the Flexor Tendon Repair Risks and Complications page. I'm Dr. Colin Hong, a plastic surgeon here in Toronto, and I'd like to take a moment to walk you through some of the important information you should understand before undergoing this procedure. Flexor tendon injuries can have a significant impact on hand function. Surgical repair, followed by hand rehabilitation, offers many patients the opportunity to regain movement and improve quality of life. But as with any surgery, it comes with risks and possible complications. These may include tendon scarring, limiting movement, or causing stiffness; failure of the repair, especially if the tendon is re-injured during healing; permanent loss of function, even with a successful repair; nerve or blood vessel injury during surgery; skin sensitivity changes or permanent numbness; infection, bleeding, or delayed healing; visible scarring, firmness, or contour irregularities; rare but serious complications from anesthesia, blood clots, or cardiac issues. You may also require additional incisions or even future procedures to address scarring, complications, or poor tendon function. It's very important that you follow all post-operative instructions and attend follow-up care, because the outcome depends not just on the surgery, but also on proper healing and rehabilitation. Please take time to read this page carefully and review the informed consent document for full details. If you have any questions or concerns, don't hesitate to contact me or my team. We're here to support you every step of the way.